So I wanted to start like a new series. I used to do like these muscle of the week breakdowns, but what I found from people is they, especially massage therapists and other soft tissue practitioners out there, is they want some more instruction and some tutorials and things like that. So each week I'm gonna release a new video specifically talking about a certain muscle in the body that I treat a lot, give you a breakdown video of palpation, give you an idea of like the function of the muscle and some tips to really go in there and treat it. First up today, what I want to talk about is the subscap, subscapularis. I even brought my shoulder module out to kind of give us a little bit of a breakdown in there. So let me make sure I get orientated right. So subscap lives in the front part of the armpit, really deep inside the muscle. It kind of mirrors the infraspinatus on the back. Now, a lot of people don't really understand the role of the subscap. So the subscap is one of the classic four muscles of the rotator cuff muscle. You have the supraspinatus, infraspinatus, teres minor. They kind of stabilize from the back, but the subscap is the only one that stabilizes from the front. It's classically considered in a lot of like internal rotation and stuff like that. But usually the subscap gets really beat up and is a wreck in a lot of people with forward posture where they're sitting there, people that do a lot of overhead work and things like that. The problem is it's really difficult to treat, and most practitioners aren't treating it effectively. They're either too compressive on it or they're not actually breaking down and getting into where the subscap is and getting an effective treatment on it. Because the thing about a subscap is if you treat it right, it should hurt but not be excruciating, and a lot of practitioners out there aren't really doing that. So what you're going to see first is I'm going to put a clip in from our training course called the Peak Method, where it's actually me breaking down the advanced palpation of the subscap muscle so you can really get an idea of where you're going. Because a lot of times what I find is that practitioners aren't even treating the subscap correctly because they're not actually finding it. And what they're really treating is the lat, the teres major, and really just pinning down the skin and not getting an effective treatment on it. So watch that palpation video. Now the last muscle we're going to look at is going to be the subscap. So I'm going to lay on your back. And for this one, be nice and use a little bit of lotion, unless you don't like the patient. So essentially, the way I like to set this up is I like to open this up and I let the table do the work for me. So I let this relax right here on my quad. This allows everything to relax. I get the lotion in there nice and easy. And then essentially, what I want to do is I want to find some landmarks to let me know I'm on it. Usually what happens when people treat this subscap, they're actually putting pressure on like the teres major or the lat, and it's not an effective treatment. A lot of people are like, oh my gosh, that hurts so much when they get it treated. It's because you're not on the subscap. So essentially what I like to do here is open this up, and then I pinch here, and I know this is all the lat, and this is all the teres, and then I know up here is the pec. And what I want to do is dissect the middle of that, and I'm going to go in, and I want to aim right up towards the throat. And what I'm able to do is once I find those landmarks is I sink in nice and slow. And if you go in too quick, you're pulling skin, the patient will not like that. So I sink in nice and slow, and don't rush this one. As you sink in, your thumb should start to disappear. If you're seeing the whites of your thumb or the nail, you're actually on that teres or that lat. So what I do is I sink in nice and slow, taking my angle right up towards there, and then I go all the way in until I feel the skin push back on me. Now I know I'm as deep as I need to go, and I back out just a little bit. And then the key here is you're going to take your depth straight down into the tissue, and it's not that thick. A lot of people are way too compressive, and it doesn't need a lot of compression, so you just let it sink straight down and get in there and feel what you can feel for palpation. See if there's any scar tissue in through there and if it needs treatment. Now the thing about the subscap is it's very important. It's the only muscle that stabilizes that shoulder from the front. But the problem is a lot of people are too quick with their palpation. They don't find their landmarks. They don't get in there how they should. So be slow with it. Find your landmarks, and the subscap palpation will be a lot easier and less excruciating for the patient. If people are wincing in pain, it's either because you're on the lat, you're on the teres major, or you're pulling too much skin. Slow down, use some lotion, and make it a more effective palpation so you can get information about what's going on in the muscle so you can treat it effectively. So I hope that palpation video helped, but the treatment of the subscap is really, really important. And like I said, a lot of practitioners out there, they think they're treating it correctly and they're really not. If you think about the area of where the subscap is going, and we talked about that, when you go in with your thumb and you go in, you shouldn't actually be able to see your thumbnail there. It should actually be underneath the pec and in there a little bit deeper. If you're seeing your thumbnail out further, you're probably on the lat and on the teres major, and that's just going to hurt like hell. And people always equate treatment like if it's excruciating, it must be doing something. No, you're just too compressive. So in order to effectively break down scar tissue, which I teach in my method called the peak method, is you have to get proper depth, then tension. And what happens is people are way too compressive and they trap that muscle. So then when you have the client go through that range of motion and you're moving it, doing some type of myofascial release, you actually trap that muscle and it hurts and you're not getting anything down there. So you want to get proper depth, back off, then tension in the right vector. But it all starts with being able to find the area effectively. And that's what that palpation video did there and as well, because subscap is really important. I never start with subscap when I'm treating a shoulder. Usually what I like to do first is get in there and clean up infraspinatus, the joint capsule as well, and clean those up easier because they're a little more easier to get to and restore some of that range of motion. Then I go after subscap. But a lot of people have egos. They're like, yeah, I'm the shit. I'm able to get in there and I can do this and that. And they're not even treating that muscle. And really check in with yourself. Like I said, if treatment is excruciating and it hurts like hell, you're not doing anything. All you're doing is inflating your ego and just jamming on some shit that's not really doing it. So getting to the effective muscle and finding it makes it a much better process for you and the client. And that's what we teach all the time in the peak method, is first figuring out which muscles are dysfunctional, figuring out how to palpate them correctly, and you saw a little taste of that in the palpation video. Then I show you how to effectively treat it so you can get long-lasting and functional-based results. So the muscle we went over this week is subscap. It's very important, and slow down, palpate it. And I always say in order to go fast, you must go slow, and that's what I'm trying to teach. If you're interested in finding out more about the peak method, send us a message. All the information is down below, and become one of those peak method trained practitioners and really start getting results and start helping people get a more effective, quality, hands-on, not symptom-based, I said it wrong, functional-based treatment, so they're not actually just chasing symptoms, and you start fixing people and you become a true solutions provider. Appreciate you watching the video. If you like it, give it a comment, a share. If you have any other muscles you want us to cover, reach out. We're always here to help, and stay tuned for the next one. See you guys. Bye.